Welcome to the Essentra Health podcast series. I'm your host, Yeji Lee. In this series, we bring you helpful information to support your well-being and to overcome the many challenges that life can bring. Our aim always is to bring you information or actions to support our well-being that are accessible to everybody. In light of National Substance Abuse Prevention Month this October, our podcast today is on characteristics of substance abuse and ways to help those who may be dealing or recovering from substance misuse or abuse. Our guest today is Norman Weiniger, Vice President of Clinical Services here at Essentra Health and licensed mental health practitioner, as well as nationally certified addictions counselor.
Thank you, Yeji. Glad we could speak about this important topic today.
Thank you for being here, Norman. To start off, I want to ask, how common is substance misuse in the U.S.?
Yes, according to the 2024 National Survey of Drug Use and Health, about 50 million people, about 17% of the population aged 12 and older, met the criteria for a substance use diagnosis in the last year. Over 13 million, or about 38% of young adults, admitted to using illicit drugs. And additionally, according to the National Institute on Alcohol Use, about 28 million adults had a diagnosable alcohol use disorder in 2024. And by the way, most of those 28 million are not in treatment or getting assistance. And we'll take a deeper look at alcohol misuse in another podcast, Yeji, but today we're going to focus on other illicit drug misuse.
Thank you, Norman. I think, a lot of people can, somehow relate to the issue of substance misuse, but it's always very surprising to hear such alarming stats regarding substance abuse. But specific to the workplace, can you talk about some of the ways that substance misuse can affect employees and the workplace overall?
Certainly, and that's an excellent question given our services support the overall well-being of workforces and organizations. What came to my mind when you said that is that I saw a recent national survey that was talking about how around 3% of workers, they estimated, were under the influence of illicit drugs on the job. And that's a very alarming statistic. If that is true nationally, 3 out of 100 being under the influence of illicit drugs while working creates quite safety and variety of issues and concerns for coworkers and the work organization. More generally, there are some ways that substance abuse typically affects the workplace, and it's along the lines of lost productivity and job performance, accidents and injuries, absenteeism, of course, theft, low morale among employees, conflicts with supervisors or with other employees. It can involve signs in the workplace such as, not getting as much work done or a drop in the quality of work product. As I mentioned earlier, maybe showing up late, calling in sick. Sometimes people who have substance misuse issues have more changes in their mood or changes in their behavior that people notice, that something does not quite seem in character with their typical behavior. And of course, there are a lot of physical symptoms, Yeji, of people being under the influence in the workplace, and companies, of course, have policies around that issue to try to keep everybody safe. another kind of symptom, I guess you would say, in the workplace can be people who seem to constantly have financial issues and are maybe looking for their employer to give them more financial help or advances than normal. So um, these are some of the workplace signs that people may be struggling with substance misuse issue.
Thank you very much, Norman. And I think lastly, just to close, I think can we talk about some effective prevention strategies for substance misuse, as well as resources for substance misuse?
Absolutely, and I guess that's the crux of what we're wanting to get at today. And I think the first thing is I love these national awareness events and efforts that really have the overall effect of getting people to talk more about this issue and to learn more about this issue, because there are a lot of things that can be done. There's a lot of help out there, and I just want to do our little part to help get that word out that people don't need to kind of suffer alone with this issue. That there are things that can be done to get assistance. First, let me back up to say there uh, a range of substance misuse conditions. And that's one thing to understand. And it's another thing to understand that often those conditions tend to get progressively worse as the person continues to use um, alcohol and drug misuse. And sometimes the best time for intervention is when there's some type of crisis has happened. And we would hope that the crisis is relatively mild. Sometimes it's tragic and severe. Those are the times when people are most open to getting assistance. Um, what do we teach our children about issues like this? Um, Avoiding peer pressure and how to cope with that. And of course, that's something that takes time and effort to help develop in children and in others. We all live in a society that is a pretty stressful society, Yeji, and so sometimes people misuse drugs because it's a way to cope with stress. It's a way to help manage these underlying emotional conditions. So, helping our children and helping ourselves to manage stress and to manage underlying emotional conditions, anxiety, depressive symptoms, that kind of thing, without resorting to the use of drugs is one pathway. And toward that, we would encourage people to look at how they maintain a balanced life. Sometimes people who uh, turn to and get involved in alcohol and drug misuse don't have a very balanced life, don't practice a good self-care, don't have skills around stress management, conflict resolution with other people. All of those kinds of skills help people to avoid the trap of falling into abuse of alcohol and drugs. And concretely, what can people do to get help? Well, they have this issue or they have it in their families or friend circle, keep in mind that your employee assistance program is a great place to start. Employee assistance programs offer free access to behavioral health professionals that can be of enormous help to people to get started down the right path toward recovery or help their family member get started down that path to recovery. So I would say EAPs are a great starting point, Yeji. And another great resource is a government helpline, and it is 1-800-662-HELP, 800-662-4357. That's with a federal agency called SAMHSA, and SAMHSA also has a great website, provides a lot of information about treatment services, prevention strategies, and a lot of other good resources. And that website is www.samhsa.gov, samhsa.gov, and it has a lot of resources where people can learn much more. Hopefully those resources are helpful. And Yeji, I think the most important message is if people don't struggle alone. If you have someone that, if you're struggling yourself, or you have someone in your loved ones, family who have this issue, reach out and get help and take some action. That would be my encouragement and my support for people, Yeji.
Thank you so much, Norman. SAMHSA is a great website. I know here at Essentia we refer to SAMHSA a lot for, anytime we want to do some research on substance misuse. So I'm glad you mentioned that. But it's very important information, and I'm sure everyone learned a lot today. I think this particular issue is one that almost everyone can relate to on some level, some more than others. So I think it's, very important that we shed light on it and provide some ways to get help. And so with that, we conclude today's podcast. On behalf of everyone here at Essentia Health, thank you for listening.